Thank you, Chairwoman, and ranking members as well. And thank you to our panelists. And Mr. Godfrey, thank you as a fellow Iowan. Thank you very much. I'm not a Bulldog, I'm a Hawkeye, but nonetheless, we thank you for your service. And before I begin my questions, I would just like to respond to some comments made by one of my colleagues that implied that the Office of Workers' Compensation should more closely monitor state workers' compensation systems. And I associate myself with comments made by Ranking Member Fox. I think it's important to point out that state workers' compensation systems are already effectively monitored through state oversight, insurance regulation, and research specific to each state. Adding another layer of monitoring is not necessary and could result in unintended consequences for insurance policy holders. State systems are highly effective at addressing the localized concerns of employees and employers, and we should continue to ensure that states, not bureaucrats in Washington, can regulate their systems. And with that, Mr. Godfrey, this November, the United States reached a grim milestone by surpassing 100,000 drug overdose deaths in a 12-month period for the first time in our history. The pandemic has only exacerbated opioid and drug misuse. Meanwhile, the Department of Labor leadership recently reallocated resources from its opioid management to COVID-19 claims adjudication. Do you believe it was an appropriate time to raid FECA's opioid management fund?
First of all, answering your first comment, I'm a Bulldog, but I'm a Hawkeye fan, so so it's good to talk to you. But in terms of the transition was made there during the initial time frame of COVID, I think the reason that is allowable is because the FECA program and the prior administration as well had done a great job in terms of reducing the dependency on opioids. We had seen the levels of FECA claimants that had been taking opioids for greater than a year go from 9,000 down to 1,500. And as we move on to the PBM, the pharmacy benefits manager, we have very strict guidelines that are going to be put in place, which will make it even more difficult and more stringent to control opioids, leaving them to 7-day prescriptions, after which the physicians will be required to present significant evidence through pharmacy management and physicians and the FECA program to get further opioid prescriptions. So I do think that the program has done a great job.
Yeah, I think that one of the cost of the pandemic and how we've responded to the pandemic, and it is, I addressed this with Dr. Walensky and Dr. Fauci on the subcommittee on the coronavirus task force, is the number of excess deaths. And we now know that the number of excess deaths from how we handled COVID-19 with lockdowns, isolation, banning social gatherings, that has led to excess deaths, which are now in excess of what has happened from COVID-19, if in fact all deaths were COVID-19 and not somebody hospitalized with COVID-19. And in fact, the San Francisco Chronicle had published earlier this year, and then in fact has followed up with data that the deaths from overdose in the 18 to 45 year age group, in contrast to those deaths from COVID, which are in the elderly age group. So these are 18 to 45-year-olds are twice what they were from COVID. So I think it's extremely important that we recognize that in trying to treat a pandemic, that we're also creating harm to other individuals and individuals in a younger age group. One of the other concerns I had was that earlier this year in Ed and Labor, we had a markup on COVID-19 funds with a presumption of COVID-19 in the workplace for longshoremen. I will readily admit that we do not have any ports in Iowa, and I'm not exactly sure how longshoremen work, but in my mind, longshoremen are not in close contact with other individuals, such as they are in one of our other facilities or manufacturing facilities. And we recently addressed that individuals that are more isolated in their workplace, i.e. truck drivers, don't have the same degree of risk to other individuals. So can you tell me what's the average work hour of a longshoreman?
Congresswoman, I cannot do that. What I can note, though, is, I do share your understanding that, my first job out of law school was representing IBP. I've driven through Ottumwa many, many times. I know the close proximity they work. I know the hot, steamy environment in which they work. I know that there are many occupations which obviously have considerable exposures that could occur.
So
simply by
my
their work.
concern
I
is,
don't know the work
I
hours.
do apologize for interrupting you. I'm so sorry. But my point is that when we make a presumption of COVID-19, when contact tracing, as a former director of public health and talking to my local public health agencies who have done contact tracing, the majority of disease is coming from the community, from outside the workplace, where people spend 8 hours in a workplace, but where there have been mitigation strategies put in place, the vast majority of their time is outside and infections are community acquired. So we're placing an undue burden on employers when in fact we're, as former colleague said, we're socializing the responsibility for where COVID-19 came to employers and taxpayers. Thank you, and I yield back my time.
Thank you very much.